Hello, my name is Dominique Cross, and I am a nursing student at Indiana State University. This is the Community Health Nursing Course 444, Health Education Project number 1, and I will be talking about hypertension. After completion of this video, the students will be able to identify what warrants a person to have a diagnosis of hypertension, explain what organs are affected by hypertension, recognize the signs and symptoms of hypertension, discuss modalities that are effective to prevent and/or treat hypertension, list the risk factors that can lead to hypertension. At this time, you can pause the video and click on the link below in the comments section of this PowerPoint YouTube video. In this video, I will be talking about the pathophysiology and diagnosis of hypertension, the epidemiology and prevalence, the effects that hypertension has on organs, the prevention and management of hypertension, risk factors for hypertension, patient education, treatment of hypertension, and the post-test at the end of this video. So, what is hypertension? Blood pressure is the amount of pressure exerted by the blood against the wall of the arteries. These vessels carry blood away from the heart to other organs in the body. According to the CDC, blood pressure rises and falls throughout the day, but if it stays high for too long, the heart may become damaged and possibly develop health problems. The condition is also known as hypertension, which is characterized by elevated blood pressure. High blood pressure occurs when the walls of the arteries accumulate a buildup of plaque caused by cholesterol. The arteries subsequently harden and narrowing occurs. Over time, this restricts the blood flow and may become blocked at some point. This causes the blood pressure to become high in order to maintain homeostasis until the arteries and/or heart gets weak and causes damage. A blood pressure reading can be used to diagnose hypertension. Other diagnostic and lab tests are used as well to determine if there is a secondary related issue. Hypertension is also known as the silent killer. According to the World Health Organization, approximately 1 in 5 or 21% of adults with hypertension have it under control. Hypertension is diagnosed if, when it is measured on 2 different days, the systolic blood pressure reading on both days is greater than 140, and/or the diastolic blood pressure readings on both days is greater than 90. Worldwide, hypertension is one of the leading causes of premature death. This condition, as I stated before, is known as the silent killer. Hypertension is sometimes undetectable, and an individual could have high blood pressure for years without any symptoms. Therefore, blood pressure should be checked regularly. Blood pressure normally varies during the day and may increase during a doctor visit, which is called the white coat hypertension. Your doctor will likely take several blood pressure readings at 3 or more separate appointments before diagnosing you with high blood pressure. Ambulatory monitoring is a test that is used to monitor blood pressure in intervals during a 24-hour period. The doctor may recommend lab tests such as urine tests, a urinalysis, and blood tests, including a cholesterol test. The electrocardiogram measures your heart's electrical activity. It is painless, quick, and non-invasive. Another test is the echocardiogram, which uses sound waves to produce images of the heart. The prevalence of high blood pressure among race and age. According to the American Heart Association, in the U.S., African Americans have one of the highest rates of high blood pressure. The prevalence of high blood pressure in African American non-Hispanics stands at more than 40%. Additionally, high blood pressure usually develops earlier in life and becomes more severe for African Americans. According to some theories, African Americans have higher rates of obesity and diabetes. Scientists have also found that African Americans are much more likely to be sensitive to salt, possibly because of a gene. People who inherit this gene can raise their blood pressure by as much as 5 millimeters per mercury by ingesting just 1 extra gram of salt, which is half a teaspoon. Now I'm going to talk about the effects that hypertension have on the organs. Hypertension can damage many organs in the body if not treated. Over time, pressure level increases and conditions go unnoticed until serious health problems arise. High blood pressure can affect the heart, the brain, the kidney, the endocrine system, and the eyes. The heart is damaged. The heart has damage to the arteries, and a decrease in blood flow can contribute to a heart attack. With the brain, if there is a decrease or blockage of blood flow to the brain, a stroke could occur. In the kidneys, the stress of hypertension could cause chronic kidney failure. With the endocrine, having hypertension can cause type 2 diabetes secondary to CVD. In the eyes, untreated blood pressure can affect the vessels in the retina, causing eye disease. Signs and symptoms of hypertension. Most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. When symptoms do occur, they can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ears. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. Risk factors for hypertension. There are conditions that can increase the risk factors of getting high blood pressure. There are two types of risk factors that play an important role. These are called modified risk factors and non-modified risk factors. Modified risk factors, which means there are factors an individual can change, and non-modified risk factors, which means an individual has no control to change. Can high blood pressure be managed? Hypertension can be managed with a proper diet. A DASH diet, which stands for Dietary Approaches to Stop Hypertension, is aimed to reduce high blood pressure or even prevent it. The DASH diet provides daily and weekly nutritional goals, and the number of servings you should have depends on your daily calorie needs. Just by following the DASH diet, you're likely to lower your intake of sodium, which is often the main culprit in the development of high blood pressure. Regular exercise may help decrease high blood pressure. A routine of activities, at least 150 minutes a week, would be beneficial to lowering blood pressure. Limiting alcohol and caffeine intake and cutting back on smoking cessation may reduce the development of high blood pressure. Avoiding or limiting stress may also help to lower blood pressure. This means trying to target your stressors, thereby eliminating or coping with them as best as possible. And then there's medication therapy. Your primary care physician can prescribe medication to decrease your blood pressure and decrease the workload of the heart, such as beta blockers, ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, alpha 2 receptor agonists, and combined alpha and beta blockers. Patient education and treatment of hypertension. If there are no issues with hypertension, continue with healthy habits. Invest in a blood pressure monitoring device. Keep a diary of your blood pressures and take them with you to your doctor's visits. Take medications as prescribed. If a dose is missed, do not double up, just get back on schedule. Contact your PCP if you have any issues when taking medications. Nurses make the patient aware of side effects. When in a lying or sitting position, rise slowly to prevent dizziness or lightheadedness. This is called orthostatic hypotension. Refer the patient to a dietitian if needed. Make sure not to miss any doctor's appointments. This is to ensure a better outcome and promote an optimal quality of life. At this time, please revisit the link below to complete the post-test. Thank you for watching this video.